So by prejudging somebody, you sort of you're really taking away from them. I remember a story told by Ralph Gray. He was one of my mentors when I was a resident at Emory. And this old farmer comes in dirty overalls, Well, he didn't know he was a farmer. He was just a guy in dirty overalls. And he was not in shape. Ralph presented him the treatment. And he was hesitant about presenting it because it was costly at the time. And the guy goes, okay. And the guy gets out and he gets into a big pink Cadillac and he drives back to his 35,000 acre farm. So you never know who people are. You can't prejudge people. It's not fair to the people, and it's not also fair to yourself. It's not fair to the world because you create a standard that you think is the standard of care, and it's not the standard of care out there.
This is the Open Wide Podcast with your hosts, Scott Drucker and Jinesh Patel.
All right, and we are live. Welcome back, everyone, to another episode of the Open Wide Podcast. I'm your co-host, Scott Drucker, and I'm here with Jinesh Patel. Jinesh, how's it going?
Good. Glad to have Mike on here. I love the book, and I'm looking forward to getting a good conversation in.
Well, thank you.
We have Dr. Michael Sonick already on the line, and this is a conversation I'm particularly excited about. So we'll just go ahead and jump right in here. Dr. Sonick is a fellow periodontist with a thriving practice in Fairfield, Connecticut. I'm going to give a super short synopsis of his resume here because he has had quite the illustrious career. But he has, aside from being a full-time private practitioner, he's authored many peer-reviewed clinical journal articles. He's authored a book on implant site development. He is now humming with producing educational content, both scientifically or clinically oriented, as well as oriented towards dialogue or the relationship with patients. And so most recently, Dr. Sonick here has published his book called Treating People, Not Patients. And there's a ton to unpack in the book. I'll kick it off by saying I think this book is truly a gift to practitioners in general. I think there's a ton in the book that is just not covered in any sort of formal training. Mike, I know part of what you do now, you're also a part-time professor at NYU, UConn. Maybe you deliver some of the content to your students there, but we'll get into some of that in just a bit. The book, Treating People, Not Patients, talks about in a nutshell, taking a very patient-centric approach to treatment, a whole body approach to treatment, all of that viewed through what I'll call hospitality lens. And the hospitality aspect, that piece of it is where I want to kick off the conversation, Mike, if that's okay with you. So it seems throughout the book, you talk about, you drew a lot of inspiration from acclaimed restaurateur Danny Meyer, and in fact, I think he wrote a little review of the book that's quoted on the book, which is awesome. You also drew inspiration from his protege Will Guidara, who wrote Unreasonable Hospitality. Can you kick us off here by giving the audience a sense of what is hospitality in dentistry and healthcare, and what does hospitality in our space mean to you? I'll start there, and then plenty to unpack.
Yeah, I think it's a good question, and a lot of people answer it very differently. One of my mentors, Dan Sullivan, a strategic coach, says, we expect service. We don't expect hospitality. So if you're in a restaurant, services, you order a hamburger, cooked medium, it comes to your table, medium with the tomato that you ordered on and a side of fries, and it's put in front of you. That's service. And in dentistry, it's like you're seating a patient, you get them numb, they don't feel any pain, and you do the procedure, and then you say goodbye. So that's the service. People expect service. Hospitality is sort of unexpected. And Will Guidara talks about it in his book, unreasonable hospitality. He takes it to another level. And what hospitality is really making someone feel loved, in our field, it would be making them feel safe, making them feel cared for, and going above and beyond. And one of the things that we do in our practice is we name things. So we name this called the wow experience. So we want to give everybody in our practice at every visit a wow experience. So that's something unexpected. So, like I just checked into a hotel in Chattanooga, Tennessee. I was there for a day giving a talk on people, not patients, to a group of about 100 people in a periodontal practice and their referrals and its team. And it was a hotel, a nondescript hotel. It was a Westin downtown Chattanooga, which is it's not really a vibrant community. I don't expect much. But when I walked in there, I could see they were really trying. There were 5 people parking cars, yet there were no cars. And then I walk in there, and there's a guy looked like he's not even 16, comes up to me in a suit. He's trying. And I knew they were trying in this hotel. He goes, "Can I help you?" And I'm looking at it. I go, "Do they hire 14-year-olds in Tennessee?" And then I went to the front, and they were really nice. And they offered me a bottle of water. Then I went to the gym, which was clean and neat. And I came back to the hotel room, and I put a "Do Not Disturb" sign on my room, because I don't want anyone to go in my room when I'm not there. And outside the room, there was a bottle of wine, a box of chocolates, 2 bottles of water, and a note from the general manager of this hotel. It wasn't a special hotel, but like I'm looking at that, and it wasn't a handwritten note, but it was a note, and it had his name, and it had my name on it. And I'm not a special member of this hotel chain or anything. I'm just someone who's staying there. I didn't pay for the room. Someone else paid for the room. And so that I looked at that, and then I looked how clean and neat the place was. I'm thinking, like, this wasn't, I'm not staying at the Four Seasons. The hotel was probably $225 a night or something, but they were doing the best they could. And if I ever go back to Chattanooga, I'll stay at that hotel because it gave me that wow experience. So what does it look like in a dental practice? Dental practice, it could be all the things that I talk about in my book that are done. It's the little things that we do to make our practice extreme different than anywhere else. And I see it in the airline industry now. You really get better care on airlines, right? But now, like I travel a lot, like maybe once or twice a week. Delta I don't know what they did. They just upped it. It smells better in their lounges. They greet me. They say, "Hi, good to see you there." They tell me when I check in now, there's an automatic concierge. It tells me where the gate is, how many minutes to the gate. It's really, really nice. And when I leave, sometimes they even know my name. They say goodbye, have a great day. That doesn't take much, but it's a little special. So I'm thinking, like, I want to fly Delta from now on. And I don't really like where the airport is because I got to go to Newark to get it instead of LaGuardia. That is no hospitality in Newark. Sorry for your people on Newark here, but it is a special place when you get that little bit of an extra. I got it from you today, Scott. You wrote me, I don't know, 2 or 3 times this week. A lot of podcasts I get on. You know how many podcasts I've been on where I'm there on time, I'm waiting, and they don't show up? I've had that happen like 5 or 6 times. And then so I call back and I go, "Oh, let's reschedule." And I'm thinking, like, you missed the opportunity because if you want to talk about hospitality. So you called me, you emailed me, and you sent me a link this morning, and you told me how much you enjoyed reading the book. Whether you read it or not, I have no idea, but you said it.
So 2 times for the record.
Okay. So
listen. I did the audiobook.
Oh, that's fine. I mean, then you're tired of listening to me. 6.5 hours of me. That's another experience. But anyway, and then I because I got that from you, the first thing I think is like, I'm coming on to do a podcast, but I want to make you feel good. So I wrote back, looking forward to getting on there. So we had this nice dialogue, although we don't know each other very well, back and forth. So when I got on here, you're very welcoming, you're very inviting. And because I do a lot of these things, it's not always that way. It's interesting. And you set yourself apart, being a little bit different by giving me that hospitality, even though it was just a digital introduction. Those things all make a difference. And we forget about how much that makes a difference to the people that we serve.
So I don't want to give away too much because I think the book is great, and I think everybody should go get a copy and consume the content. But can you give us a little teaser of something that you do in your practice that really delivers that wow? That's that very unexpected, that leaves the patient thinking, just like, that was an incredible, totally unexpected experience.
I'll give you a summary of the book right now. And it's be nice to people. And if you are nice to people, it's totally unexpected. And I'm not talking about reading from a script. And I know there's all these people that can come in your office and teach you how to use the telephone, and they give you a script in front of it. I just hire really nice people that want to serve. And it's part of our core values. And we have 3 core values. We have 5, but there are 3 that are sort of cut in stone. You have to have high integrity. You can't work with anybody that doesn't have high integrity because we'll all pay the price for that. You have to be a good teammate. You have to support everybody else because in a lot of practices, people fight. And they go, oh, so and so didn't clean the instruments, and I'm cleaning the instruments. In the dental office, they all go after the hygienist, and the hygienist goes after the assistant. You know the drill.
Oh yeah.
And so they got to be a good teammate. We don't, and they're all really good teammates in our practice. And the third thing is you have to be servant-hearted. And what servant-hearted means that you really want to be there to serve the people that come in. You want to make them feel safe. So I have a phenomenal team. So if you call my office, right now, you're going to get someone nice on the phone. You're not going to be put on hold. You're going to be picked up immediately. If you walk in, they're going to probably know your name. If you have an appointment, they're going to know your name. If you're a new patient, they're going to know your name because we go up on Google and find out what you look like before you even walk in. So that's a little something that don't do. We have a picture of every patient in the file. So when they walk in, if there's somebody new there, they know what the people look like when they walk in. You walk into the office, it's neat, it's clean. It's the cleanest office you've ever been into. There's fresh fruit in the reception area. We had to take them out during COVID, but the apples are back now. There's aromatherapy going on. It doesn't smell like a dental office because it's sitting right there in reception. We have 20 different magazines, all different types, not of just my ones. I don't even know what we have, but they're all different, all different for everybody. And it's just the artwork is nice. It's tasteful. There's never any trash. We have big flower pots when you walk in there that are changed seasonally, that are about 8 feet wide, that are just gorgeous. The carpets get changed every 3 years. The floor gets waxed every 3 months. The office is cleaned every night by a whole team that comes in. We have a beautiful garden outside. We have a white bench that you can sit on. It says "Be the Gift." I mean, everything from that office, from the moment that you decide that you're going to become one of our patients, is like, wow, that's different. That's different. Our website has 1,200 pages of content. I mean, it's just I can give a master class on how to put together a website. It's nothing's cookie cutter about the practice. It's all stamped with we want to be here to serve you. We want to make you safe, and we want to give you a great experience.
So I want to piggyback off of that. So in
By
addition
the way,
to,
Scott, I'm sorry,
go ahead.
I'll give everything away, and you can get it free. I mean, I'm not here to sell the book. I'm here. Let me tell you what my moonshot is. My moonshot is to change the way healthcare is delivered by everybody in the healthcare business, not just dentists, not just hygienists, physicians, oral surgeons, plastic surgeons, orthopedic people.
Amazing.
That's what I'd love to be able to do.
I want to get there. I just want to meander a tiny bit before we do.
Okay.
One example that struck out to me, and I'll just share it here with the audience, is you and your team listen or your team listens to the conversation that takes place between you and the patient, and you may mention, hey, there's this amazing bakery in down the street or in town, right, or there's this topics of conversation arise that have to do with other, we'll say, other businesses or other experiences around you. And when the patient goes to check out, you have directions printed out to that bakery that you talked about, or to the right park that you talked about. Was super nice to go and have a relaxing afternoon, maybe after a procedure or whatever. You listen, and then you literally will hand the patient a tailored kind of list or guide for them, which is wildly unexpected. I don't know any office that does anything remotely close to that. So
11 Madison Park does.
Yeah. Well, any clinic, I
ate there. I took my sister there for her 65th birthday, and it's all vegan now. And I looked at a piece of artwork that was pretty cool, and I said, I just happened to mention to the server, I said, "That's a nice piece of artwork. Who is that?" And she knew. And on my way out, they handed me a picture of the art with a blurb on the artist. It was already printed out, and I thought that was pretty cool. And it wasn't Will Gadara that did it. The cool thing was the whole. And he doesn't even know love Madison anymore. But his fingerprints are all over that restaurant. They still do it. It's very cool.
Yeah, it's funny because I also read those couple books a couple years ago. Danny Meyer's Setting the Table and Unreasonable Hospitality.
So you love this stuff. If you've read that,
and then I came across. Yeah. I was mentioning that to our mutual friend Jeff Ganellis.
Yeah,
and he said, "Oh, you have to check out Mike's book. He talks about exactly this." And so I was like, "Yes, this guy gets it. Got to bring him on the podcast."
Well,
I want to sort of take the conversation from you. You described how much thought and how meticulously you curate the experience of your clinical practice. And throughout the book, you talk about how important all of the little details are, because from even before the patient walks in to the door of your practice, maybe they're on your website, maybe, or maybe they walk in and just kind of look around the reception area, they are judging whether they realize that or not. They're taking in all these observations and making judgments about you and your practice. But there's kind of a duality here, because they judge you from the moment they walk in. And so you take a ton of care and a ton of, pride in that care. But you also say you should never judge your patient on the flip side, right? Like they can come in looking, like they're just coming in off the street, totally like unkempt and, regardless, it doesn't matter. They're a person, and you're there to guide them through this journey of healing, essentially, right?
Mm-hmm.
And then maintaining health. So yeah, can you comment on that? It struck me as I was going through your book.
Yeah, there's a quote by Milton Glickman that I use in my practice when I teach. He was a general dentist that was a member of the American Academy of Periodontology. And he says, not all patients can afford, or want everything that we offer, but it is our duty to inform the patient of all the things that are available to them. And I'm paraphrasing it. And I think that's very important. If we prejudge a patient, because most dentists, well, first of all, we're human beings, Scott. We're all meaning-making machines, and we judge everything. You've already judged. I have a T-shirt on. You probably see I have an Oura ring on. You say, oh, he doesn't have a fancy watch. He has a $39 Timex that he's wearing. So I mean, this is, by the way, I like it, but it's also with intent. I don't want to walk in with a big watch like that, because then it's like, now all the famous people, Jay-Z won't wear a watch that costs under $200,000, if you go to a party. And it's actually the big funny thing in New York. They're ripping off watches at famous restaurants. They're pulling up in scooters and ripping them off. So anyway, let me go back. I was digressing, but yeah, we all judge everybody all the time. We can't help it. But that's not my job. My job is to provide the highest level of care that patient wishes to receive. Okay, so I don't make a decision. If we get into maybe the Bob Barkley things and the co-discovery, which is, I think, very important. It's important that we educate the patient and bring them up to a level so that they can make the decision that's in their best interest. Use the restaurant analogy. Everyone knows the difference between, chicken, fish, ice cream, salad. If you go to a restaurant, you're going to order dessert. You can know the consequences of that, because we're adults. As kids, you won't. But patients don't know the consequences of not doing scaling and root planning, for example. And they go, I just want this tooth fixed. I don't want to treat anything else. I have patients call up, all the time and go, I just want to have this one tooth, and I don't want you to look at anything else. I have dentists tell me, when they've heard, not anymore, but they used to, they go, I'm sending the patient over for tooth number 3. Don't do a comprehensive exam. I remember once early in my arrogant care, I was very arrogant when I was younger, and I'm not anymore, but I was very arrogant because I had a standard and I expected everybody to live up to that standard. As I got older, I realized that's just my standard. I can't judge other people for not doing it. And that standard actually created a niche for me in practice where people see me who want that level of care. And the dentists that refer to me are dentists that want that level of care for their patients. So when that dentist told me to only look at tooth number 3, I wrote this nasty email back. I was in an airport, waiting for a plane and go, all right, I'm going to do this. I turned to my wife. She goes, don't send it. I go, I'm sending it. And it's actually a guy who's a good friend of mine. I go, what if I find oral cancer? Should I just ignore it? And it was like, because we found cancer in our practices, sure. Right? I mean, it's like, we can save lives as dentists. I mean, it's sort of, who else looks in the mouth but us? And I think it's important that we're comprehensive. So by prejudging somebody, you sort of you're really taking away from them. I remember a story told by Ralph Gray. He was one of my mentors when I was a resident at Emory. And I already knew this, but I just remembered the story because it was funny, because Ralph was in practice in Buckhead at the time. And this old farmer comes in dirty overalls, Well, he didn't know he was a farmer. He was just a guy in dirty overalls. And he was not in shape. And, Ralph presented him to treatment. And he was hesitant about presenting it because it was costly at the time. And the guy goes, okay. And the guy gets out and he gets into a big pink Cadillac and he drives back to his 35,000 acre farm. So you never know who people are. And, I walked into an art gallery in Santa Fe and they started showing me $2 million pieces of art. I'm thinking like, what is he? I mean, he doesn't know. I was there with a T-shirt and shorts. He doesn't. I don't look like anything in my Timex watch, but you don't know who people are. You can't prejudge people. It's not fair to the people, and it's not also fair to yourself. It's not fair to the world because you create a standard that you think is the standard of care, and it's not the standard of care out there. So we're judging all the time, and we're selling all the time. On this podcast right now, I'm selling to you, you're selling to me. You're both looking at me, nodding when I'm talking. You got to do that to make it seem like what I'm saying is interesting. That's what we do every minute. I sell to my team. I rehire my staff every day. Every day I walk in there. Hey, Ashley, how you doing? Okay, great. How's the baby? Good. Feeling better? Okay. And I walk around. I have 20 employees. I make sure I touch base with them personally for at least 10, 15 seconds. It doesn't take much just to acknowledge their existence. If I come in like an hour late, like today I don't work, but I'm going to go into the office and do this video for a course. I'm going to make sure I acknowledge everybody in the office, and I make sure I say goodbye to everybody in the office. Not everybody does that. We're not all trained that way, and I think it's really important. Most of the stuff that I do, you guys knew when you were 6 years old, but we just don't do it anymore. And it's so basic. And in Danny Meyer's introduction to his book, he talks about, you may think that we're in the business of serving food, but we're really in the business of doing something that's even greater. And that's creating, very meaningful, sustainable, safe relationships, hospitable relationships with the people that we serve. And then he ends it. And this is the line that I love. He goes, it's that simple and it's that hard. And it is simple what I'm saying, but it's hard. It's simple to be a good periodontist. Just remove the calculus, reposition. I mean, we go to these courses where we learn how to do these things that very few people ever do. But the basics, if you're of a periodontal practice, I don't have to tell you this. It's teaching any dental practice. It's showing someone how to brush and floss and getting their teeth clean every 3 months, or if they need it. And that's the basics. It's it baffles me that people don't do the basics and they just don't do these things. But what it does is it creates a tremendous niche if you want to be at that elite level. When I say elite, I don't think I'm better than everybody else, but that level where you're booked, because I'm booked 4 months in advance. I mean, I don't have a 2-hour opening until end of December, and I don't do marketing. It's internal. I mean, we do some marketing, but I do that for my younger associates. But everything has been done just internal where my people. I don't even need many for even new patient referrals. They're just the people that are in my practice want to get the most ideal treatment possible. It's a great place to be in. I wasn't there when I first started. It took a long time. Just like right now, I'm starting to develop this concept of treating people, not patients. I've been doing it for a couple of years. I'm really early on, like I am in my practice. I feel like I'm going to get this out there, and people are going to go, 5, 6 years from now, people. Hopefully, this is my goal. People will say, "Oh yeah, you got to read this book if you're a clinician." I've lectured to plastic surgeons in New York City, some of the top ones in New York City that are really great, and they brought their team in, and they read the same books that you read, Scott. All of them. If I'm going on too long, because I get really excited about this, please stop. I can get very specific.
This is great.
No, Michael, I want to get back to the university thing here in a second, because I think there's some interesting tangent there. But I want to talk about, everything that you talk about when it comes to just unreasonable hospitality from a startup perspective, because I see that book is also like a business book. Like you even have business people review it that aren't dentists.
Right.
And the thing that we are always taught and that I take away as well is you can't compete a lot of times if you're bringing something new to the market on just pure product. A lot of times it's really a lot about the white glove service you provide and the experience, the onboarding that makes people come back, tell their friends about it, to reduce the customer acquisition cost of the next one. And so I see a lot of the lessons learned in terms of creating this experience that you're going to tell your friend about, you're going to tell your spouse about, you're going to tell somebody about, to be like, that was not normal. Even though for you say like, that's normal to us and who we are as people, but it's hard to present in like a business fashion. But the one comment I have right now, and I would love for just to get your opinion on this, as businesses get bigger, it's tougher to have that moment. And I'm not saying it's impossible, but it's just, you have to be more intentional about it.
Right.
And I know in the dental world specifically, we're starting to see aggregation, roll-ups, DSOs. And I want to see if is there any advice for those going through those scale moments on how they could keep that unreasonable hospitality or, that intention behind their practices like you do? And how easy would that be to kind of teach across the board? Or is it something you should confine locally to make sure you can do that? Like, what's your advice to those people?
That's a really good question. And it's one I've thought about quite a bit because I only have one office. Right. So when I opened up my office, I don't know if you guys know a guy named Whitehall Management, Greg Stanley, if you heard of him. He's an older guy. He's been around forever. But I remember the first year, he goes, if you want to open up another office, he says, before you do that, get into a cab in St. Louis and take it to Chicago and then hire another cab just to drive along with you. Because if you enjoy paying for that second cab, open up a second office. And that's what I see a lot of people doing. They want to open up multiple offices to, but you increase your overhead unless you can staff it. I do think you can scale it. I mean, there are businesses of scale. I mean, if you go to McDonald's, I mean, it's the same thing everywhere. You go to, I mean, what's the fast food place that's known for great service? Chick-fil-A, right?
Chick-fil-A.
Yeah. And, they do some things that are unusual. They're not open on Sundays. Okay. They got a different type of politics, but there's a line to get into those places and the food's not great. But the service is very consistent when you go into them. Most of those chains, the really high end ones. I mean, Shake Shack is Danny Meyer's chain. It's the best hamburger in a chain, that is out there. And you see them in airports. If you travel in airports, you see there's lines waiting to get into these places. Dunkin' Donuts is the same thing. Now there are some high end places too that do very well. You've heard of the Four Seasons. If you go into any I've never had a bad experience in Four Seasons. Okay, and they have thousands of employees. Okay. The Ritz-Carlton's different because they're not owned by the same person. So the Ritz-Carlton is a except for the one in Paris. The Ritz-Carlton, you buy the name and then you run it. It's sort of like a franchise, but you have to do certain things a certain way. I use the example of my partner, Dr. Ray Ma, who's in the book. His name's not in the book because he didn't want his name in there. He's Dr. John. And Dr. Ma joined me speaking broken English from mainland China. And I'm in the Northeast where it's the Seinfeld culture. It's sarcasm, it's back and forth, which is a lot of pitter. And he didn't understand all that. And I taught him that. And I had him watch all of Seinfeld. And he does it. He doesn't have my personality. He's not from the Northeast. He's from the North. He's from the northeastern part of China on the North Korean border. In a small town of 2 million people that came here at age 20, speaking broken English, he's a typical American success story. Done a dime in his pocket, graduates valedictorian, with a degree in biochemistry from the State University, puts himself through Tufts and the residency program, and now joins me. And now he's, you wouldn't know it. He's just killing it. And he practices this culture. And so does my entire team, but we teach them. So there's trainings for this. You can do the training. I have a whole training program. I do it personally, but it's also in the book. At the end of each chapter, there's 3 or 4 pages where it asks questions and it gives exercises. But I also have a video series. It's inexpensive. It's like $490. That's 3 or 4 hours, and it has a workbook in it. And at the end of each 15-minute module, there's an interactive staff training that you can do. Most practices, boutique practices don't practice these principles. They're not at all. I was out with, I have dinner with a lot of periodontists, and it's amazing how successful people are without practicing these principles. I've seen some crazy stuff out there,
Well,
and it's amazing. And but these principles are learnable, and if you teach them to people, I think you can do this on scale. Now, when the DSOs come in, they buy the practice. Do the principles go away? Well, it really depends. DSOs aren't running the practice. It's the people in the practice. I'll be honest. We sold to Specialty One over a year ago. Our income is up. The satisfaction of our team is up because everything is because there's an organizational level that I'm not big on that. That's there. They know exactly. I don't have to talk to them about their vacation. I don't have to talk to them about their benefits. Their benefits have increased, and the joy in our office is unbelievable. My team is now putting out videos on social media that are amazing. They threw a Christmas party in July in the office. I had nothing to do with it. I walk upstairs. It's Christmas, pinned the tail on the Christmas tree. I mean, it was amazing. And we gave him $80. My partner gave him $80 because he sold some gold from some patients. He goes, here, throw a party. We paid the food. They went to Home Goods and Michael's, and they put this unbelievable party together for lunch. And it was so joyful. And the video's online. They did during the Olympics, they did a relay of a patient forgot the toothbrush. So all of them got together and they did like a handoff of the toothbrush across the parking lot. I'm seeing this stuff and I'm saying to him, I go, what are you putting this stuff on? I'm laughing. 800 views. Okay, so and it had nothing to do with it. So the culture, you can actually create a culture that will stay. Is the culture going to be the same if I'm not running it? Is the culture going to be the same if Danny Myers isn't running his restaurants? Well, Danny Myers isn't anymore. He's got 30 restaurants. There's still 3 of them in the top 30 in New York City. He's got, Danny Myers is now a billionaire. But I always go to Danny Myers restaurants. My favorite restaurant is Gramercy Tavern in New York City. He's not in there in the kitchen. He's not running it anymore. He was, but not anymore. So he's been able to do it. Will Guidara doesn't even own 11 Madison Park, and the culture is there. Is it as good as when he was there? I doubt it. It. It's not as good. But when I go there, hey, would you like to see the kitchen? Oh, Will Guidara? I go, well, I read his book, yeah, let's take you back. I couldn't get reservations. I got the name of somebody there. By the way, I'm trying to get in this week. Can you get me in? I send him a copy of my book. Boom, I'm in that night. And I get a tour of the kitchen with my sister. We're sitting in there. It's a pretty special service. By the way, you can get a tour of a kitchen of almost any great restaurant. If you show some enthusiasm for what they're doing and you tell them that you understand it, they'll take you back there because they want those soulmates back there, the kindred spirits. It's very cool. I mean, as you can see, I'm very passionate about it. I'll walk out of a restaurant if I get a bad. It's called the blink moment. Malcolm Gladwell. If I walk in, it's over. And you asked me, Scott, earlier, what else do we have? We have a beautiful bathroom in our office. Beautiful. My office bathroom is better than my bathroom at home. Well, maybe not.
That's all. I don't know.
That's pretty nice.
I don't know if you ever heard the story of Buc-ee's, the gas station that became super famous and popular because their bathrooms are just immaculate. And they were like, that's how we differentiate ourselves. And people are always used to the truck stop bathroom mentality of it being like this dingy, probably disease-infested space in their heads, but in those, it's like it's better than your home bathroom, and it's in a gas station.
I know, they drive miles just to get into that place.
Yeah, right. They'll have signs up that says your next Buc-ee's 300 miles away, and people are like, okay, and that's crazy marketing.
It became a destination.
You just gave me an idea. I got a photograph of Buc-ee's and put that. That's going into my next lecture right now.
There you go. I love that one.
Mike, I wanna double click on the cultural aspect here, specifically the education of the soft skills. And you talk a lot about this in the book, and it's obviously extremely pertinent for literally anybody running or working in a healthcare setting or in any other setting. Truly, Jinesh and I have gone back and forth talking about this in a number of different ways, and that is the education that currently exists in dental schools today, and whether or not it's adequate from a human interaction perspective, and whether the soft skills are appropriately taught. Curious to hear your thoughts around that.
Yeah. Well, I mean, how much training did you get in customer service in your I'm
holding up a big zero for those listening to the audio.
Chime in that I don't know what any degree, to be honest, besides maybe psychology or that they teach these soft skills in professional school. So I think this is a very sage point, whether you're a dentist, doctor, or just a professional of some other sorts, like an engineer. We didn't get these skills. That's why most of us are weird.
Well, no, I don't think we're weird because I think most dentists are the way they are. We haven't talked about this. I don't know if we'll have time to about the hiring and the profiling that I do.
I do want to get to that.
Yeah, that's something that I was on a. I'll talk to you about a conversation I had with some periodontists about that. Some very successful periodontists had me on to speak on a Zoom call, and I was given my typical 3-hour thing on people, not patients, and I got about 5 slides into it. Somebody asked me about hiring, and that's all we talked about for 3 hours without any material. But anyway, I think the training is very important. We should teach this. And that's where there's a void. And that's where there's a need for this. I think I am the only clinician, someone who's actually, I don't mean to brag, but I'm the real deal when it comes to being a periodontist. I mean, I've been teaching it for 40 years and I do all the perio stuff. And I hope my patients aren't listening, but I really don't love that. I love connecting with human beings. That's what I really love. This is my sweet spot now. I'm having a lot of fun talking about this because I wouldn't be able to do all those other things, unless I connected with people. So the human connectivity is a very important piece. We should probably have Tony Robbins go to every dental school in the country and talk about it. He actually has a dental program. He has a program for everything, but he actually has one for, if you look Tony Robbins up in dental, you see his program on that. It's the same one he gives to everybody, but he just puts dental in front of them. And the program on human connectivity has nothing to do with dentistry. It has something to do with us as other human beings. Now, I do believe, and this is, I don't know if it's spiritual or if it's quantum physics, I do believe that we are all connected. It's so, it happened to me 2 days ago. I saw a guy in the morning who I very rarely see. I'm thinking about him, and I spot him 3 times at a music festival. None of them were him. And I don't even know this guy well. And then I'm leaving the festival, and there's Dave. I go, Dave, I was just thinking about you. And he goes, yeah, right. And I was. I don't know this guy well, but there was something out there that I was vibing for this guy. And I said it to him. And then we ended up having a 30-minute conversation. And he talked to me about all sorts of things that were really important to him about something I was doing. It was really amazing. And that only happened because I think we're all sort of connected. I do think by connecting with our patients, there's that aha moment that happens, and you really want to happen very early in that relationship with the patient. It's like within 30 seconds. It's not even 30 seconds. I think it's like 6 seconds. But it's that aha moment where you can connect, and then you can relate to them. Then you just take them along the road to whatever they need that's in their best interest. I jokingly say that I'm a spiritual manipulator. And what I mean by that, I didn't write about that in the book. What I mean about that is that from a spiritual level, taking someone from a lower level to a higher level of comfort, of care, and something that they don't even know exists. You take them to the promised land. Plato's allegory of the cave. They're sitting in the dark. Come on, guys. There's light out there. No, I don't believe it. Take all these guys out of the cave, and there's light. It's too bright. I want to go back in the cave. They didn't even know what normal was because they're in the cave. And that's what our patients are. They don't know that. And once I show that to them, what the problem for me now, this is going to sound a little funny, but they all say yes. And they all say yes to complex treatment. Now I got to go do the treatment. Now I got to go do the ridge augmentations and the grafts and get the orthodontist involved and build the whole team. So all the things that we love to do, most dentists love to do, I get to do. I'd like to just do the consultation and have a bunch of other people coming in there like Lee Sheldon, bring you in, Scott. Hey, Scott, this do the work, but I don't think you'd want to do that either. But it's very, very important that we get this training in dental schools. And we're doing patients a disservice because I talk to people all the time and they go, hey, Mike, I got a great case for you. I have a human being in need that feels badly about who they are. They have no self-esteem. They can't eat. They're in pain. They have an infection. They do have no romantic involvements because they're embarrassed about what they look like. Their wife does not go to a baby shower because she's afraid of her teeth falling out. The husband doesn't go out to dinner with his wife because he's embarrassed, so they have to eat at home. I mean, all these things that happen to patients because of their teeth. So I just started, I do martial arts, and I haven't done it in 19 years, and I've been doing yoga. So I just went back as I'm getting older, my short-term memory, I want to work on that. I want to work on balance and all these things. So I go back to the dojo again, and I'm terrible. And so even though I trained for 19 years, I have a black belt 19 years ago. So they gave me no belt. I had to train for 4 months to get a white belt. And so my instructor, was making me go through all this kind of stuff, making me do respect. He's making me act like I'm a 6-year-old going to the dojo for the first time. He's putting me through all the things that are really, really important to get me there. And he's treating me terribly. I mean, not terribly, but he's treating me like I got to respect this guy who's 30 years younger than me. He's making me fold my uniform before I leave to teach me discipline. So anyway, I got my white belt, last week, and I posted a picture of it with my instructor, which, by the way, is nationally ranked. He's 5th degree. I mean, he's nuts. This guy from Korea. He's not nuts. He's a great guy. And I asked him to collaborate, and I saw him today. I asked the manager, I go, who does the social media? And they go, he does. I go, the karate instructor does social media? So I turned to him. He goes, yeah, I posted a picture. And he goes, oh, you did? I go, I asked you to collaborate. So he's on there, and he didn't know what I did for a living. He had no idea. So he goes, oh, you're different on social media than you are in the gym. I go, well, that's who I am. He goes, you do this, the teeth stuff? I go, yeah, because I thought you were a lawyer. I'm thinking, is that how I come off, like a lawyer? And because I don't talk to him because I've got to respect him. So he's got a dental problem. All right, he's got this dental problem. Now, not all, but the majority of my close friends and colleagues are Korean, happen to be. I have a Korean orthodontist, I have a Korean prosthodontist, I have a Korean chiropractor, I have a Korean partner. And so I start talking to him he starts talking about his teeth. He knows nothing about his teeth. He hasn't been to the dentist in 3 years. And his teeth are all crooked. He goes, I don't know if I can straighten him. Will I be able to still teach karate? straighten? I go, well, I mean, Tom Cruise straightened his teeth, and he's in front of the public, right? So I think we can straighten the karate instructor's teeth. So but when I saw that, he was this scared little kid. He went from this 5th-degree black belt that was kicking my butt to this scared little kid that talked to me like I was like a little bit someone, because I had this knowledge that he didn't have, and he has no idea about treating people, not patients thing, but he saw that as a professional, and that's what all of our patients are. I watched him I usually see it the other way, because I usually see people coming scared, and all of a sudden they trust me and they leave with hope. And he went from, being this strong, virile man who runs all this big studio to someone who's really scared. And he didn't stop talking about it. And he was doing it in front of the other adults. And one of the adults is a physician. We're all looking at it like, we've never seen the side of this guy before. That's how people are when they come into our office. We're not taught that. We're not taught in dental school, in medical school, that people come in are scared, they're vulnerable, they're fearful, they don't trust you, they're afraid of pain, they don't know what it's going to cost, they don't know how long it's going to last, they don't know if the outcome's going to be very good. Are you going to take care of me through the process? We don't give them the information. We say, hey, you got this is your diagnosis. You got generalized moderate to severe periodontitis, but you got some frication involvement, you got some mobility up there. We're going to have to lose that tooth. I see it all the time. And we take out teeth. And we put people in the denture, but we don't tell them what denture's like. I've never worn a denture. By the way, I have 20, as you probably know, I have 23 crowns. I've lost 9 teeth, but I've never worn a denture. What's that like? And I see my colleagues, people who I respect, who I work with all the time. They go, oh, we can't save those. I put them in a denture. Well, they've been in my office for 35 years with the severe periodontal teeth, and I've been scaling them, and I get them on a 3-month recall, and they smoke 2 packs of cigarettes a day. Let this 79-year-old woman die with her infected teeth, because, she's going to die much sooner when we put her into that denture. And that's one of the things that we're not taught. We're not taught to enable well-being. We're taught to do procedures. Tal Gawande talks about this in his books, because his father got very sick and died of cancer, and he became a patient. Tal did, and his father became a patient. They're both doctors, and he felt he was mistreated by the system. I call it getting involved in a medical or dental vortex, where you get involved, you get on a stairway, and you start going down, and by the time we're done with you, you're worse. Bob Barkley talks about this. He says the purpose of dentistry is to usher patients through life slowly as they get worse. And that's what I see. Most of the patients, 90%, I don't know, maybe 80% of the patients I see are in my office because the dentistry didn't go well. I'm not blaming the dentist. I'm not blaming the patient. It's just they didn't have the information. And I think every problem that we have as a race of humans, okay, is due to us not getting the information out there, being short-sighted, and going for quarterly profits, global warming, all the wars. I mean, we have all these people bombing each other now. They're going to be trading partners in 5 years. Why don't we get to the trading partners part first? We dropped the nuclear bomb on Japan, and they're our closest ally. I mean, do we have to drop the nuclear bomb? Maybe a conversation might have worked a little bit better in that area. It's
different podcast.
I mean, it's out there. What are we doing? I mean, it's silly stuff.
Right.
I mean, we talk in these platitudes, but we just don't do the common sense. So when I talk to groups of people, I go, I'm not a Democrat or Republican. I go, I created my own party. It's called the Common Sense Party. I go, so far, I'm the only member. I go, would you like to join? And most people, if given common sense, telling them what the basics are, if we tell our patients what's going on, you got an infection, and this is what we can do to treat it, and it's only going to cost, $500 or $1,000 or $1,500 to scale your teeth and get you on recall, and we'll stop all disease. We'll stop it cold. You won't get it. How many periodontists talk about caries control? Almost none. No. Do I give? I have a sheet on everything. I have a sheet for every problem. Yeah, I have a sheet for the local bread factory down the road, but I also have a sheet like if you have high caries. I also have a sheet if you're having trouble sleeping. I also have a sheet if you're having trouble with your jaw pain. And on that sheet, I just rewrote it yesterday. I have 5 or 6 different references of other doctors that can help you. I build the team. I think my greatest skill, as a dentist, is being able to see the future of my patients if they don't do the dentistry, and to be able to put together a team, a network to take care of them. And oftentimes, my karate instructor, he goes, well, should I see this person? Should I see this person? And I realize what he needs to do. He needs to come to my office. I'm going to give him a no-charge consultation at FMX. I'm going to examine him. I'm going to put him in the right hands. I'm going to put him in the right orthodontist and the right rostodontist, and I'll maybe do a little scaling, and he'll be fine. But he doesn't know that. He doesn't know that. Just like I don't know if I have to go through all these little things, like maybe in 5 years my memory will be better and I'll have better balance. He knows that.
Right. I do. Jinesh,
you got me on a rant now.
No, that was great.
I love 2 things, and I just want to point them out. One is like when you walked in the dojo, obviously you were a different person and your environment changed and you respect the teacher. Obviously, it's
Right.
a fifth degree black belt and amazing. And then when he goes into your office of work, he is you going into the dojo, which is I'm here to respect this person. This
Right.
is their place of business. They're the expert. And there's a book I love, and I reference it to a lot of people. It's called Pitch Anything.
Yeah.
Uh, it's
Yeah.
it's
I
that
have the book.
knowledge frame that
Yep.
I think that's what carries on through this, and I believe it's a perfect example of it. But utilizing it from a sense of better patient care, I really don't think I've seen a lot of examples of that. So I think that's a great thing to lean on, especially for those that are trying to get that sense of what can I do to best prepare my patients for the future? Use that knowledge frame to help them understand what that is. And I think that's going to be valuable moving forward. So I appreciate you even like
Yeah.
bringing it up.
If I just put together, because I do a lot of teaching on this topic, and the more I teach it, the more I'm refining it, and I realize what sort of resonates with dentists because I'm trying to get them to understand it. And I put together a series of before and after photos of patients, and it shows the joy after we just fixed their teeth. And I go, that's what I see when you walk into my office. That's what I see. I see you down the road, a year, 2 years, whatever it's going to be later, changing you. And I said, we as dentists have the ability to change people's lives. And I don't think we go to work with that. I go to work every day. I said, let me be the gift to my patients so I can change their lives and make them healthier, happier, and have better self-esteem. My patients have better self-esteem. The ones that have really bad. I treat a lot of people who have really bad disease. They have much better self-esteem after, we do the rehabilitation. I'm not talking about doing a bone graft in tooth number 30, a free gingival graft, but the things that we do to change them. And I call it there's something else we do we're underappreciated. It's like being a good parent. Kids don't grow up and they go, "Thank you so much for being such a good father." When I was like 8, or 7, because most aren't. But what I call it fixing the leaky roof. You fix a leaky roof, there's no difference. The roof's not. It was a little leak, you fixed it. But if you don't fix the leaky roof, what happens? The roof goes, and then the second floor goes, and then you have a few $100,000 rehabilitation. And when we do scaling roof planing on a young person that has like 6 millimeter, 5 millimeter pockets, that's fixing a leaky roof. But if I tell my 30-year-olds, I said, you're not going to appreciate what I do for you. I go, but when you're 70 and you're talking to your friends and they go through all this periodontal therapy and you're losing teeth, you go, you'll remember that 40 years ago, we gave you, the habits. It's like teaching someone how to fish. That old analogy. So, are you going to say
Awesome.
something, Scott? I'm sorry.
No. This has been great. I do want to loop back and so be sensitive of time here, but loop back to the hiring conversation because Jinesh
Sure.
and I talk about this a lot. I can certainly speak for myself and say that hiring is one of the most challenging things that I think that I've experienced building a business and I've made mistakes where we'll make a hire thinking, on paper, person looks great. They interviewed super well. They seem to vibe well, to find out, whether it's a week or a month or a year later,
Right.
really that was not a good fit for the team. So I want you to talk a little bit about your process here. And I know you have a pretty meticulous process, takes time, but seems to work well for you. So to share that knowledge with the audience, and then you sent us ahead of time a whole long list of interview questions that you ask folks that interview for a position,
Right.
presumably with your practice. And I want to actually touch on a couple of those and maybe offer a tweak and then an addition to your list.
Okay.
So first, I'd like if you can share with us the process that you go through.
Sure. I will say that the process that I'm using now, I didn't always have, but I also have the best staff now and best team I've ever had. So I like everybody in the office. We hire, based upon our core values, and we try to have people that are aligned. You mentioned that, you hire someone, you like them, they vibe well, and then, a couple of weeks later, they're the wrong person. Well, by the time we do that interview or revive, we've already pre-screened them. So we do a lot of pre-screening. So our process is as follows. And by the way, all this is on my website and it's free. So you can actually get a little download of a lot of these things. But I also have a module in my course on how exactly to hire that comes out with all the questions and everything else. So first thing we post the ad. We usually do it on Indeed or something like that. Or we used to do a few places, but I really don't even know where it's posted anymore. But we have a nice ad, and the ad talks about our office and what we do and a little bit about our philosophy. If someone responds to the ad, we want their resume, and they fill out their employment history, and they have to do something called a culture index. Now, everybody on my team has done 4 personality profiles. We don't use DISC; it's not very accurate. Most people use DISC; they all know it. We use the culture index, which looks at 7 different indicators of personality traits. It doesn't look at integrity, it doesn't look at intelligence, but it looks at how autonomous are you? Are you a leader or you're a follower? Are you very social or are you quiet? Are you fast paced, slow paced, detailed, not detailed, logical or very emotional? Okay, are you creative or not creative, and how much energy you have? And those 7 characteristics, when you put them together, come up with about 20 different personality profiles. And some of them we just don't even look at. Okay. And some of them I don't want. I don't want to hire a leader because I'm the leader. Okay. And I'm the only leader in the practice by my personality profile. We need some more leaders in there. My partner is not a leader. He is a clinician. He's a phenomenal clinician, but he doesn't really like to do the leading thing. So we look at that. And that's the best piece of advice I get. If you don't know about the culture index, learn about it. You can email me or you can call Michael Hall at Culture Index in Dallas. He's my mentor. And I look at my team, what my tailor will do, who manages all that, she gathers the resume, the culture index, and the employment application. If they don't fill out the culture index, which about 50% of people do, she'll ask them to do it again, but 50% don't. We already got rid of 50% of the bad people right away. And then I look at the culture indices, and it takes me, I look about 5 or 6 a week. It literally takes me about 10 seconds per resume to look at that. And it's yes or no. If it's a yes, which is probably 1 out of 100. So we've already had 200 people apply. I got 1 out of 200. I said yes. Then we do the FaceTime interview. I don't do it. Taylor does that. She goes into a private room. She does it. Half the people don't show. They're gone. All right. So we're really, and then the other half that are on there, are eating a bagel and nursing a kid and driving the car at the same time. They're gone. Or they go, what office is this again? And we ask a lot of specific questions. If they pass that, then they come in for the blink interview. The blink interview is where they sit at a table and I look at them for about 4 seconds and I know if they're a good fit or not by the way how they're dressed and what they look like. Dirty fingernails, bad teeth, filthy hair, dirty clothes, scuffed shoes. Sorry, it's hair, eyes, teeth, clothes, fingernails, shoes. Boom. You can immediately know if somebody is right fit. If they don't stand up when I walk into the room, probably going to get out of there. If they don't look me in the eye, probably got to go. So these are all the things. Like I had a guy come in the other day from Ireland, and we have an international office. We have I'm in Connecticut, which is not the most international place in Fairfield County, but we have 23 employees, and I have 12 different countries, and we speak about 9 different languages. And so we got a guy in from Ireland. We don't have anybody from Ireland, so they all liked him. And he had a suit on he's coming in for sterile tech, and he had this big beard, and he was great. And he knew a lot about me. He was on the whole site. He goes, I'll shave the beard if you want. And that was the first thing you're going to be a sterile tech. I don't want this long beard in sterilization room. Sorry, Scott and Jinesh, a couple bearded guys. So neither of you would be hired for a sterile tech. But the fact that he offered to do this meaning he wanted the job. So in that blink interview, I knew this is going to be a great employee, and I'll be blown away if he's not. Then he comes back after that. I review him. My office manager does. My partners, a couple other people. Then they spend a day with us, and then the final decision is not made by me. It's made by my team. They're going to find things, and they're going to ask him a lot of personal questions, and because they've all been with me for a while, everybody who works for me has already been vetted. They're going to make the final hire, and then they come in and they work, and most of them work out. If they don't work out, they're usually gone within 3 days. The people that don't work out are the people that are upwardly mobile. I've had a lot of people marry people that don't have to work anymore. Or I've had one person become a PA, another one became a dentist, another one went to hygiene school. 2 of them went to hygiene school. My dental assistant now is moving. She's going to become a radiology tech, where she can make significant amount of money. It's so that's how we hire. And we always ask them if they've done our core values. And I have some questions that I ask, but it's usually I get them. I try to stress them out. I try to talk to them. I find out what stresses them, and I ask them questions about what bothered them in their own job. If they gossip and tell me about that, they're gone. So I don't want any gossips. So if they start trashing the previous employer, they're gone. So there's a lot of tells that come in there very, very, very quickly. If they go, well, things didn't really work out, it just wasn't good for me. I'm looking for something else, or I wasn't able to grow. They say something like that. That's better. Then I ask them about their hobbies. What do you like to do? I actually, I know I'm not supposed to say this, but I like to hire athletes. Athletes do better because this is a tough job. I got to stay in shape. If I'm not in shape, I'm in pain. I was in pain in the middle of my career. I had to change some things up. It's a hard job. So I think that's enough on that hiring piece.
Yeah, that was great. Going through the list of questions, there are a number of interesting ones. There are a number of sort of standard ones. What's a strength that you have? What's a weakness, etc. I found that having gone through God knows how many interviews, tweaking that second question, instead of asking what's a weakness that you have, asking what's a strength that you wish you had.
That's a good question.
Is a kind of a more impactful way to
I like that.
Open people up a little bit. An interesting one that I heard that I started adding in, and I found is really, really helpful, is asking what is a common misconception that prior coworkers have had about you. And that allows them to open up, and you may have fallen into, made some assumption about them based on something you saw or something they said. And then it gives them the opportunity in a kind of, in a friendly way to open up and just address that. It also sometimes they may open up and say something that's like, oh God, like that is not what I'm looking for.
Well, the thing that I look for, a lot of I don't, by the way, the list of questions, I never ask any of them. I just have a conversation.
The truth comes out.
Yeah, I already know who they are.
Sure.
So because the culture index is so clear, it's 91% accurate. I will go into a room I did last weekend in Carlsbad. I had a room of a dental office with 20 people. And I went through everyone's culture index. And I turned to him, I go, because I saw someone who was very quiet. I go, people don't know how strong you are. And I go, this group here thinks that you're very, you're not friendly. I go, but that's not it. You're just a shy person. This is who you. That's how clear it is. It will blow people away. That's, by the way, that's why I don't have time to go into the story, but that's why I ended up using it, because I was called out in a room of 400 people by the person who was my mentor, and he knew exactly who I was, and he never met me. He was talking in an auditorium.
Nice,
and it blew me away. The question, what I do want to find though is I like to get them emotional about something that bothered them. I want to find out what their level of integrity was.
Mm-hmm.
And so I said in a previous, what has upset you? What have you found very upsetting in a previous office environment that you could not really live with? And then they're going to talk about something, like whether they're really gossipy or something. That's how I hired my partner, Raymond. I found out his button. He has 2 buttons, but one of them was integrity. He doesn't show emotion. But when he started talking about someone who was violating integrity of a patient when he was a resident, he got very angry. And I go, good. That's good. It's good. It's good to see that's what makes him angry.
Nice. How are you doing on time, Mike?
Well, probably wrap it up. Well, I mean, I'm the boss, so okay. And it's not a patient; it's a pig jaw that's waiting for me. So
fair enough.
I'll just text him. I'll be 15 minutes. Okay.
This has been a phenomenal conversation. I got to wrap up here too, Scott. But at the end of the day, Michael, I think there's a lot of just interesting nuggets that you have in how you approach your business. And me and Scott love hiring and interviewing. We know that's the thing that makes a company beat and what can actually crumble a company. So I appreciate that. The way that I've done my interviews, because I'm usually the last interviewer of every employee because we're still small and growing, is I basically say all the things that would make you want to walk away. I'll be like, we're a startup. We don't have profitability. I can't guarantee this company's going to be around next year. My job is to make sure that doesn't happen, but how does that make you feel? And it's like making sure you get all the painful things that can happen out of the way. And if they're leaning in versus, leaning out, that gives me that body language of this person can go through the roughage of this journey and that can't. And I think with the questions you're asking are very similar in terms of your business, but I'm the person who tries to scare them into not taking the job. And if they're leaning in and getting excited about hey, we don't have a blueprint for your success, but you get to pave your own path. How does that, adjust their mentality to this approach?
Yeah, that brutal honesty is such a good filter. Even from the job description, job post, just be open that, yeah, this is going to be a really intense job, super long hours. Like if you can't, you want to spare your time, which is your most valuable thing, and filter all that out before that interviewee gets to you. Right.
Yeah.
If you can. So yeah, no, Mike, this has been great. So appreciate you coming on and chatting with us. And if you have anything else to add for our audience here, by all means. And otherwise, I think this is a great place to wrap.
No, thank you for having me on. This is something that every practitioner I know struggles with, even if they're really good at it. There's always ways to hone it. I mean, I've sort of made it my life's work, so I have a very different perspective. But we're not taught this way, and most of us don't become dentists because we want to become hospitalians. As
Yeah.
as people say.
Yep.
We do it for different reasons, but it's a very important part of becoming a really excellent clinician, and it's really just becoming an excellent person. When you're like that.
Yeah, and Mike, to your credit, you make so much of this free, right? You have curated all these resources, and you put them up on your site. You want to go ahead and give folks that information here in case they want to look it up.
Well, the book is Treating People, Not Patients. If you want to buy it, you can get it on Amazon, hardcover, softcover, Kindle, or audio, and I do read it. It's a 6.5-hour book. You can also go to my website, which is my name, michaelsonick.com. You can see courses that I teach. I probably give one keynote a week on this. I also do some consulting for offices. I'll go into someone's office and spend a day with them, the team, and talk to the team. If you want to really get part of the course, the live course, you can do it on a video. I have a whole video series. It's 10, 15-minute modules that comes with a workbook. And that's very good to do over maybe a 3-month period. You take your whole team through. One of the things that a lot of people don't do is they go to a good lecture. I always call it the Tony Robbins effect. You walk out of there after 4 days, and you're all fired up. And then like a month later, you forget because there's no way. So the videos are a good way to bring it back to your office and to reconnect and to see the same message. And, there are topics like, decor or, the hiring or how to tell a story, or we haven't talked about showtime, basically, how to show up like a Broadway performer and be on every time that you're in the office, those type of things. So those are good places. There's plenty of places to learn. And there's a lot of resources out there. You and I have talked about some of the other books. Well, I'm going to give a plug to this book here. This is a new book. You probably don't know about this one. Co-Discovery. Ever heard about this? Written by Paul Henney. It's exploring the legacy of Bob Barkley. So I strongly suggest you read that. It just got published. And Bob Barkley,
he's the one that died in the plane crash like years and years ago. Yeah.
1974 in Illinois. Yeah, he was a dentist that talked about the importance of treating the complete patient, doing oral hygiene instructions, and bringing the patient along. It's the same philosophy that I have. I developed it independent of him, and then when I found him after I developed it, I brought him into my my teachings. But he's he's phenomenal.
That's a whole other topic I have on my list, but we didn't have time for is
that's
treating the whole patient, but
I like
medical dental integration. What does that look like? That's a whole other episode.
There's a lot of material. I think it's great to be a dentist today. There's so many cool things you could do.
Awesome.
Well,
Well,
we'll have Michael back for that one if he's willing to in a little bit.
Sure.
Talk about that
Be happy to.
Awesome. All right, everyone. Take care, and we will see you back next time. Bye-bye.